For my culture, I chose the Hispanic culture, but to narrow down which race in the Hispanic culture, I chose the Mexican because Cuban, Puerto Rican, and South and Central Americans are also considered Hispanic. There is no official religion in Mexico as the Constitution guarantees separation of church and state. However, more than 4/5 of the population are at least nominally affiliated with Roman Catholicism. That being said, dealing with first and second generation Hispanics, they will most likely be Roman Catholic, but that doesn't go to say that everyone you encounter will have the same religious beliefs. The CDC also states that the religious affiliation of Hispanics/Latinos in the United States is 68% Catholic, 20% Protestant, 8% secular, 3% other Christians, and 1% other faiths. So, even though the first statement on this slide says Mexico, Hispanics in the United States still have a majority of Roman Catholic. For their nutrition and food, their major foods that they eat are enchiladas, corn tamales, tacos, stuffed chili peppers, quesadillas, beans. They normally have a smaller breakfast and dinner and have a larger lunch around 2 to 3 p.m. When they go out to eat at restaurants, the inviting party normally pays for everyone's food and is expected in return when they are invited somewhere to eat with friends or family. Catholics abstain from meat on Ash Wednesday and Fridays during Lent, so it would be important for us nurses to know when we have a Catholic Hispanic patient that they may not eat their food if it has meat on it. For their household size, the CDC statistics state that the household size is larger. The average size of a Hispanic household is about 3.47 people compared with 2.64 for the total population. The Hispanic households are inhabited by 3 or more generations, typically because of the economic advantage or necessity of sharing a roof, as well as traditionally close relationships. So it wouldn't be unusual for the child of a parent to have their own kids and to have their parents in the same household taking care of everyone. Many males believe their self-identity is tied to display of machismo, whereas women are often expected to be submissive and self-denying. So normally the male is the head of the household and the woman will stay home and take care of the house and make sure it's running smoothly. Hispanics are prone to certain diseases and health problems, which are heart disease and cancer. The CDC reported that Hispanics have the highest uninsured rates of any racial or ethnic group within the United States. That being said, if they're not insured, they're not getting the health care that they need, and they don't know that they will have heart disease or cancer. There's also a problem with obesity, which will also lead to having heart disease. Within the Hispanic culture, end-of-life care tends to be more family-oriented. Silverstreet states that the Hispanic group members may refuse procedures that alter the body, such as autopsy. Extended family members may be at the dying client's bedside. And Silverstreet also states that pregnant women may be prohibited from caring for dying clients or attending funerals. This could be because they feel that the pregnant woman may have bad luck being around dying people and may lose the child due to them being there. For their healthcare, as I stated before, they have the highest uninsured rates of any ethnic racial group in the United States. So if they're not insured, they're not getting the healthcare, which means they are combining healthcare practices with Western medicine or their own traditional practices. Their traditional practices include using home remedies, such as drinking herbal or spiced teas, and seeking care from relatives, neighbors, community members, or traditional healthcare providers. It's important for us to know if they're using traditional practices in case if there will be interactions with the medications and the herbs that they are using. In some cultures, such as the Hispanic, male healthcare providers may be prohibited from touching or examining certain parts of the female body. Similarly, it may be inappropriate for females to care for males. It is important to know this before you start providing care to your patient in case if it violates their beliefs. Some Hispanic patients maintain downcast eyes as a sign of culturally appropriate differential behavior towards others on the basis of age, gender, social position, economic status, and position of authority. So if they are not making eye contact with you, it is not because they are just being rude, it's what they are taught and known to do. The diseases of the circulatory system, diabetes, cancer, accidents, and violence, and diseases of the digestive and respiratory system are very common for the Hispanic culture. When greeting your Hispanic patient in a professional or formal setting, the handshake is always the most appropriate way to greet them. When two male friends meet, they have a handshake accompanied by a hug or pat on the back. When a male or female or two females greet, a single light kiss on the cheek is normal for them. When greeting a family in your patient's room, it is appropriate to greet each one of them individually with a handshake. While Catholics don't always agree with gay marriage and abortion, religious affiliation and behavior are still closely related to views on gay marriage and abortion. The Pew Hispanic Center states that Catholics, in turn, are more conservative than are seculars in their views on gay marriage, although not in their views on abortion. They don't believe that it is okay to have an abortion. They think that they should keep the baby. Regardless if they are married or not, they still want the female to have the child. It is important for nurses to be knowledgeable of all cultures, as previously stated. In some cultures, such as the Hispanic, male healthcare providers are prohibited from touching certain body parts of a female. If nurses don't communicate and ask questions about how their patient's culture will impact their care, then there will be a big bump in the therapeutic relationship. It's always important to ask their culture, their religious beliefs, food, preferences. If we don't communicate with them, they won't want to come back for continued health care.